Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General Hospital. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has been muted so they can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I'm going to introduce you all to our guest speaker. Joining us today, we have Dr. Shirley Chu. Dr. Chu is an assistant professor in the Department of Radiology at Mass General, where she serves as Clinical Service Chief and Director of Medical Education in the Breast Imaging Division. Her clinical and research efforts center around improving breast cancer outcomes by improving patient access to high-quality breast imaging care and improving the diagnostic performance of breast imaging technologies. In recognition of Breast Cancer Awareness Month, she joins us today to give a talk on the impact of the COVID-19 pandemic on breast cancer screening and the importance of continuing mammography care. So please join me in welcoming Dr. Chu.
Hi, Amy. Thank you so much for that introduction. It is an absolute honor to be here today with you all to talk about this really important topic that's near and dear to my heart. And what is one of the most amazing things of being here at Mass General is that I am certainly really not the most qualified person in this institution in the greater Boston area, where we have so many giants and leaders in breast cancer screening in the local area and at our institution. So it's truly an honor to be here today with you all, and hopefully I can share some important information with you today. So a disclaimer, I am not an expert on COVID. I'm not an expert on kind of the time course and the policies. And I apologize for having to bring us back to that year, or the kind of the terrible time that we had to go through back in March 2020. Governor Baker announced a state of emergency, and then subsequently we had our stay-at-home advisory, and kind of marking, the really life-changing and history-changing course of the COVID pandemic. And not to dwell on it too much, and just to show us how far we've come between March 2020 and March 2021, we went from our stay-at-home order and a lot of restrictions to resumption of a new normal, thanks to the development and distribution of vaccines. And we were fully reopened here in Massachusetts by May of 2021. And so I think today is also kind of a celebration that, we are back to this time where we are embracing some normalcy, sending our children back to school this fall, and a huge feat and celebration with you today, especially if you're able to join me today at this talk. So that is COVID, and what's happening with breast cancer, and what's happening with our breast health care and our breast cancer screening programs. So during COVID, there was a time when, during the stay-at-home order and the surge, we did stop elective imaging, which included screening mammogram. So after the recovery and after the opening, I know many women might have this question in their mind, basically, should I still get a mammogram this year? If you are not, already kind of tugged in all aspects of your life and caring for your family, your elderly spouse's family or children, time to think about yourself, and hopefully at least at some point, if you are at the age that should be getting screening mammograms, maybe you have thought about this question, should I still get a mammogram this year? Well, unfortunately, and I will show you some data, a little bit of hard science, but for the global pandemic, a lot of things have stopped, but breast cancer did not. So even though we have temporarily paused some of the elective screening during the very short time, the impact is significant, and I will show you that. So just to show you, during the surge of March and May 2020, the breast cancer screening volume, screening mammography, has substantially dropped based on a national database using the electronic medical record system of a vendor called Epic. They looked at their data and they saw that the screening mammogram volume during this time period between March and May 2020, it dropped by 94%. More data also corroborates. We're looking at April 2020, also during this time of surge. The National Breast and Cervical Cancer Early Detection Program, or NBCCEDP, which is a program that provides cancer screening services to women with low income and inadequate health insurance. They looked at their screening mammogram examination numbers, and they found that the breast cancer screening tests, which is screening mammograms, have declined by 87% during April 2020. And they compared this with the average of the previous 5 years from 2017 to 2019 for that month. So the blue line here is showing you the screening test conducted in 2020, and the gray line here represents the average screening test during the corresponding month over the 5-year period between 2015 and 2019. And you can see that in April 2020, the drop is significant. So looking at the slow recovery and reopening, where we are starting to open up imaging examinations and healthcare facilities for outpatient imaging, the Epic vendor, the one that's looking at their electronic medical record systems volumes, saw that the number of cancer screenings started to rise, but during March and June of 2020, the volume is still at around 30% lower than the pre-COVID-19 level for breast cancer screening. So by that estimate, between March and June 2020, that estimate would be 285,000 women have missed their breast cancer screening mammogram, which is significant. Similarly, looking back at the NBCCEDP program, they also looked at this, time period when things are, the surge is over and, imaging tests are being performed. And again, they found that even though the volumes have started to increase, it's still 40% below the expected pre-COVID volume for that June 2020 time period. So it's 39% below the prior 5-year average for that month, which is a substantial number of patients and women. They also looked specifically in the NCDDEP program, looking at the different racial ethnic groups and which groups have the most significant decline or drop in terms of the screening mammogram examinations. And they found that the American Indian and Alaskan Natives have the most significant drop of their getting their screening mammograms during April 2020 by almost 98%. That's the most significant group that's impacted. And it's followed by the Asian Pacific Islander group, which is a drop of 97%. But you can see across the board for all racial ethnicities, it's significantly impacted, ranging from 84% in the Hispanic group and to 94% in multiracial groups. And then as the volume starts to come back, when things started opening more, it still did not recover to the expected pre-COVID volume. By June 2020, the American Indian and Alaskan Native groups still has the most significant lag or decline in terms of decrease in terms of the number of screening mammograms that has been done compared to the 5-year average previously, and it's a decline. It's a decrease compared to the previous 5 years by 70%, and the Asian Pacific Islander group, follows that by still lagging behind and a lower return to screening volume compared to the previous 5 years by 65%. And again, you see that the Hispanic groups has higher return, but still there's a significant decrease compared to the pre-COVID, pre-pandemic volume of number of women getting their preventive screening mammogram service. So looking at another study using a national survey called a behavioral risk factor surveillance system, which is a national population-based data. The researchers surveyed close to 480,000 women in the US between ages 50 to 75, and they found between 2018, pre-COVID, and 2020, during COVID, the 2020 entirety past year breast cancer screening decreased by 6%. So that is very significant, and that includes even after the surge. And in 2020, they also by calculating that 6%, they translate that into an estimation of 2.13 million fewer women reported receiving breast cancer screening during 2020. And they found that the worst impact are among those women or people with less than a high school diploma, so lower educational level, and among minorities, including Hispanic, Asian American, Indian, or Alaskan Native women. So fast forwarding a little bit to last year, in January to October 2021, the electronic medical records system looked again at their screening recovery volume. And even though you can see that the volume has gotten back to kind of more of an expected volume, the comprehensive total estimate during that January to October 2021 time period, the rates of breast cancer screening still remain to be 2.7% below the historical baseline. And so these rates will equate to an estimated of 68,000 missed breast cancer screening mammograms during this time period last year, January to October 2021. So what does this mean? Why does it matter? Why are we worried about so many women missing breast cancer screening due to the pandemic? That is because early detection is better. Early stage of breast cancer is better. If we don't screen, then we worry that there will be women presenting at later stage of breast cancer, and we're not catching the early, stage 0, stage 1 breast cancer, and stage 4 would be metastatic breast cancer. So specifically exploring data that investigates that, researchers at the Moore Cancer Center at the University of California, San Diego Health looked at just this population of 216 women. So just comparing between 2019 before COVID and 2020 after COVID, and just comparing whether or not the breast cancer stage at the time the woman presents has changed because of the pandemic. And what they have shown is that, as you can see, in 2019, pre-COVID, there was a lot more stage 1 breast cancer detected or diagnosed at the time of a breast cancer diagnosis. It dropped during 2020, and then it dropped furthermore in 2021. Conversely, for the higher stage or later stage breast cancer diagnosis at the time when a woman presents, you see that it was lower in 2019, started to increase in 2020, and it's significantly higher in 2021. And these numbers were significant in their a little bit of a small population of a 216 patient cohort. So that's why we are concerned. Computer modeling has used the data, all the data that we have, to try to estimate how much this missed breast cancer screening is going to impact later stage, and then in terms of breast cancer deaths. And so Dr. Ned Sharpless, who is previously one of the physicians locally and the most recent former director of the U.S. National Cancer Institute, published an editorial in the Science Journal in 2020, kind of urging us to be careful and to make sure that we bring women back, because the effect of COVID-19 on breast cancer screening on the computer models are suggesting that for the next decade, from 2020 to 2030, almost 10,000 excess deaths from breast and colorectal cancer deaths due to this drop in cancer screening. And this is almost an approximately 1% increase in deaths from these tumor types. Looking at just the radiology, the breast imaging data, we again see a similar trend. So there's a study by leaders within our society and our national organization that's looking at screening mammograms, diagnostic mammograms, breast imaging guided biopsies, and breast cancer diagnoses extracted out of this American College of Radiology, ACR, National Mammography Database. They looked at data from pre-COVID, which is in March 2019, through post-COVID, May of last year. And again, what they found was that, yes, the breast imaging volume is recovering after COVID, but compared to the pre-COVID volumes, the screening mammography volume remains at that time still about 85% percentage of the pre-COVID volume. So it has not recovered fully, and it's certainly not rebound or has gotten higher than the pre-COVID volume. Diagnostic mammography is closer, which is 97.8%, but both the biopsies and cancer diagnoses also has dropped. So there is a deficit compared to the pre-COVID number of breast cancer diagnoses. And similarly, they also found that there's a disproportionate negative impact with the lagging behind or this drop in screening exams on older women, Asian women, facilities in the Northeast, which we are impacting us, and facilities affiliated with academic medical centers. So if the question is, should I still get a mammogram this year? And you are at the age where screening mammogram is recommended, mammography saves lives, and the answer is yes. And the time is now, and it's absolutely crucial that we're sending our kids back to school, we're returning to work, and it's important that we're returning to our breast health care and returning to screening mammography. So knowledge is power. That's why our kids are, our children are in school. So it's important to remember these messages. So first, do not wait. Early detection saves lives. Mammography saves lives. Small is good. Small means early stage is good. What happens, and we'll go over what happens during a screening mammogram, what happens when you are called to come back from your screening mammogram, what happens when you have symptoms, and the most important thing is please do not worry alone. So let's cover kind of the top three. The theme is the message is please do not wait. Small is good because mammography saves lives and early detection saves lives. So as I mentioned, is it okay to come back to schedule my screening mammogram? And the answer is yes. Is it safe? And the answer is yes. So for breast imaging and for most radiology care, but definitely for mammography and breast imaging studies, your risk of exposure to COVID is low. We will screen patients. We are screening all of the employees to make sure we have we don't have symptoms. We have testing. So our scheduling staff will reach out, make sure that you are feeling okay before you come in. They might talk to you with you ahead of time. And when you come to the facilities, you will get a mask, and there's plenty of space to provide some social distancing. All the healthcare providers, our technologists, our physicians, our staff are wearing a mask for protection for you and for ourselves. And we disinfect all the surfaces between every single patient. So it is very safe to come back. And we have all heard a lot of this data, which is 1 in 8 women will get breast cancer, and it's the most common cancer in women. 75% of the women who develop breast cancer have no family history of the disease or other high-risk factors, and that's why we need to screen them. And the most lives saved are saved from breast cancer when women get screened every year starting at age 40. So if you there's so much information. If you cannot remember anything, this is probably the easiest thing to remember if you can, if you cannot decipher all the information out there. So the message here is do not wait, because time flies. You wait for a month, you wait for another month. It's like me going to the gym. I always say I will go to the gym, but time flies, and if you wait, then you forget and life gets busy. And mammograms can find tumors that are too small to be felt. So that is great, because small cancers are easier to treat and less costly to treat. And it's also much less morbid and much less required on the patient. And most importantly, small cancers have a better chance for cure. And that is what we are looking for. So small is good, and mammogram can detect small cancers. So even though it's a shocking number to hear that 1 in 8 women can develop breast cancer in their lifetime, but we're walking around and you'll see, 1 in 8 women could be you sitting in the cafeteria right now or wherever you're listening to this talk, and you turn around and there's more than 8 women. You're sitting on the T, and in that car there's 1 in 8 women could have developed breast cancer. And that's scary, but I want to remind you that a lot of the women are survivors, and they are doing really well. And there's more than 3.8 million breast cancer survivors in the US. So even though you feel like, oh no, it's so common, but we treat them, we cure them, and most women do wonderfully. And so the 5-year relative survival, which means the survival rate of people that are diagnosed with breast cancer, 5 years, that survive for 5 years or more, is high. It's 90.6%. And even greater news, if your disease is localized, so it's early, the 5-year survival to live like 5 years or more after being diagnosed, the survival rate is 99.1%. So that is really good statistics. We have really good care and treatment. So early detection saves lives. So borrowing directly from our screening leaders within our organization at the American College of Radiology and Society of Breast Imaging, this slide borrowing directly from their presentation, that since 1989, there's hundreds of thousands of lives that have been saved by the use of screening mammography, and as well as new developments in breast cancer. So this graph shows that, prior to the widespread availability of screening mammography, and when we started screening mammogram, the breast cancer death rate, was pretty constant before that. And after the introduction of mammography since the late 1980s, the breast cancer death rate has decreased by more than 40%. So this is great news. So do not wait, and small is good, and early detection saves lives. Mammography saves lives. So what happens during a screening mammogram? What happens when you are called to come back from screening? And so just to show you the mammogram and the pictures of how these pictures are taken in terms of your positioning. So this is a picture taken from, positioning the right breast, and this is a picture taken from positioning the left breast. On the mammogram, you can see some lymph nodes in the armpit. You can see your pectoralis muscles. You can see what we call dense breast tissue, which is more the fibrous tissue and the glandular tissue, as well as fat, which is a normal component of the breast. This is the nipple here, and this is coming down to close to the belly portion. So on this picture, you can generally figure this is the upper part of the breast, and this is the lower part of the breast. When we get mammograms using compression, up and down compression, again, you'll see the nipple, which is right here on the right, here on the left. And this is for the right breast, and this is for the left breast. And here on the pictures, we're looking at the outside of the breast or lateral portion of the breast. And here on the pictures, we're looking at the inside of the breast near the cleavage or the medial aspect of the breast. So typically 4 pictures, 2 on each side. So this is just to show you the different quadrants in anatomy of the breast. It's like, this is how we look at the mammograms and how we interpret most breast imaging studies. We're looking at the pictures like we're looking at you at the patients. So this is the right breast, this is the left breast. The quadrants are upper outer quadrants close to the armpit, lower outer quadrant, upper inner quadrant close to the cleavage sternum area, and lower inner quadrant. And we also sometimes refer to locations and positions of the breast using the clock. And the clock doesn't change, and you'll see that the clock is the same for both the right breast and the left breast. And we use that to describe location of findings. So that's what to expect for screening mammogram. Out of every 100 women who get a screening mammogram, 90 will be told that their mammograms are normal. At a facility here at MGH, our radiologists are really good. So more than 90, most of the time, more than 90 out of the 100 women will have a normal mammograms, because we try not to call that many women back for more pictures. But in general, about 10 out of the 100 women who get a screening mammogram will be asked to return for additional imaging. So please do not be alarmed when you get that phone call, because it's not uncommon. It's 10 out of the 100 women. And most of the time, out of the phone calls, the women who get the phone calls, we have the pleasure of just being thorough, and we get extra pictures, and we will tell you that your mammograms are normal. About 2 out of these 10, we will be a little bit more cautious, but we also feel very reassured that there's nothing concerning, but we just like to have a follow-up imaging exam, and we might ask you to return in 6 months, just for one extra careful additional follow-up imaging exam. Very few, about 1 to 2 women will have a recommendation of a needle biopsy. So that's about 1 to 2 out of 100 women who get a screening mammogram. When you return, when we ask for you to return to get extra mammograms, some of the extra mammograms that we do might be using smaller paddles. So this is a large paddle for the typical screening mammogram, the plastic paddle. But when you come back for additional imaging, it just means we are trying to make sure everything is okay. So we might use smaller paddles, different setup, but get different mammogram images to help spread things out and make sure there's nothing going on. We might also do a breast ultrasound, and that's done typically with hand-held ultrasound at the bedside, and we will let you know what the results show. So again, just try to remind you, out of every 100 women who get a screening mammogram, it is not uncommon, about 10% or a little bit lower here at MGH, will be asked to return for additional imaging. And most of them, 8 out of the 10, will be okay. Either just go back to routine screening mammogram or just the imaging follow-up, and only rare occasion, biopsy is rare, about 1 to 2% of women per year, then we'll ask to get a needle biopsy. So in the cases where we ask women to come back in the literature, people refer these to false positives from the screening mammogram. And it's common to have anxiety, but I hope the information I shared with you today will let you know that let's not worry yet, and let's just get these extra pictures. We're being very thorough and cautious. And the risks from recall and biopsy, the anxiety needs to be compared to the 40% reduction in the breast cancer deaths that are benefited from screening mammography. And, I see many women every day when we call them back, and their anxiety from screening resolves, and there's no long-term anxiety or adverse health effects. So if you get that phone call, just remind yourself, it just means it's a reminder for you to take care of your breast health. Remind yourself to place your self-care in the center, and please come back so that we can work it up. We can do those additional pictures, and we can give you, the additional information of hopefully reassurance and good news, and send you back to your regular yearly mammogram. What happens when you have symptoms of the breast? I think my message here, the most important thing is please do not worry alone. Even if you had a recent benign or negative mammogram, please do not worry alone, and please come back, and please tell your doctors, and so that we can do dedicated imaging to make sure that your symptoms are okay, that it's nothing to worry about. So we are here for you. Mammogram is a test. So for screening mammogram, we're assuming all the women that shows up for the screening mammogram do not have any symptoms. So if you do have symptoms, please let us know. We are here for you, and we are more than happy, love to provide reassurance after doing extra pictures or a breast ultrasound to help explain or take care and reassure you about your symptoms, or work it up and do any additional tests if you need anything. But we are here for you. If you have any symptoms, please do not wait, and please come back. Please talk to your doctors. Please let your doctors know, and please do not worry alone, and we will together help you through figuring out what the symptoms mean and if there's anything to worry about. When you come back, if you have symptoms, again, we might get extra mammograms, which I've shown you, explained to you before, and we might get breast ultrasounds to further evaluate depending on what symptoms you have. So, because I borrowed some slides directly from our breast cancer screening leaders from the American College of Society and Society of Breast Imaging, I'm showing the list of contributors to those slides. And a couple of these leaders are locally here within our institution, and also locally within the greater Boston area. So we are very fortunate to have leaders and just experts locally, and within the Massachusetts and the Northeast and the greater New England area. So we are here for you. Please do not wait. Early detection saves lives. Mammography saves lives, because mammography can detect cancers when they're small, and small is good. And you remember what happens during a screening mammogram, just typically 2 pictures of each breast. It's common to be called back just so that we can be thorough. And when you have symptoms, please do not worry alone, and please come back and please let your doctors know so that we can, evaluate and give you a good answer, or at least provide reassurance. So the time is now. Please return to your breast health care and return to screening mammography. Thank you so much for your time and attention, and happy to answer any questions today.
Thank you, Chu. Dr. Chu, if you have any questions, feel free to enter them in the chat. We have a question regarding what age one should start getting mammograms, as well as what age one can stop getting mammograms.
So there is a lot of information out there, that people might think might be conflicting, but the true answer is that we know by research evidence that the number of lives that are saved, the most number of lives that are saved, is to start screening mammogram at age 40. But it's the anxiety of the false positives, and questioning about the additional biopsies and that are adding kind of the complexity to the picture. But we know all organizations are in agreement that the most number of lives saved is to start screening mammography at age 40. If you talk to your doctor and then your decision together is that, based on your overall history and, your preference and everything, that you really, really do not want to start at age 40, you definitely, please, at age 50, come to get your screening mammogram. But the recommendation here is that please start at age 40 if you feel like it's a test that you are okay with, it's a test that you wouldn't be too anxious about, and you understand the importance and value of the test, and then please start your screening mammogram at age 40. Oh, in terms of when to end, here in Boston, we have lots of women who are so healthy, exercising, and look younger than I am at age 80. I think that is a very difficult answer or question to answer. And again, I think it really will require you talking to your doctor about your overall health conditions and your your preference. But breast cancer don't stop. It didn't stop during didn't stop for the pandemic. It doesn't stop for when you get older, and so if you at any point you feel like you would do something and you want that knowledge of whether or not you have cancers and you would want to do something about it, then, and you have a good otherwise healthy more than 10 years of life expectancy, which is hard for anyone to know themselves, but so that is kind of with your doctor that you can decide that, but then there you can continue to get mammography.
Thank you, Dr. Chu. If a person is relatively healthy, no history of any cancer, family history of cancers, has had mammograms where they've come back normal, should the person still get mammograms annually?
Yes, absolutely. We saw that 75% of women who develop breast cancer do not have any risk factors, and mammogram is trying to catch things that are developing. So it's great, and great news. You don't have nothing bothering you, no symptoms, your mammogram is negative, but please come back next year so that we can make sure nothing new is developing on your on your mammogram, and if there is, it's early and we can detect it early.
Thank you. We've heard about 2D and 3D mammographies. What's being offered at Mass General?
So all of our patients and all of our exams at Mass General is with 3D mammograms. And I didn't go into the details about breast density and to explain kind of the hard science between the difference of the 2D and 3D mammograms. But you saw the mammogram I showed you earlier in women with breast, in women with breast that has a lot of this dense breast tissue, which is normal spectrum. I have a lot of dense breast tissue. It is better in terms of not calling you back more and also catching things earlier with the 3D mammograms. Here at Mass General, we do all exams with 3D mammograms.
And with that, we have a question. I don't know if you have anything you want to add to it about the accuracy of mammograms with dense breast tissue.
Yes, so like I said, mammography is a test and it's not perfect. So depending on your breast density, it is absolutely true when your mammogram has more and more and more of these dense breast tissues, and which I said it's just normal spectrum. Mine literally looks almost all white. It is true that mammography, the sensitivity is not as good as compared to a woman where her breast is mostly fat. So mammography is a test. That's why, we will still be able to see some findings and some things that can help us decide, can help us detect cancer early. But, if you feel anything, if you have any symptoms, if you have a lump, it doesn't matter if you just had a negative or, normal screening mammogram. Please bring it to our attention, to your doctor's attention, so that we can do extra tests to make sure that your symptoms, are not hidden by, the dense breast tissue, or is not limited by the intrinsic limitation of this screening mammogram test.
Thank you. Early in your presentation, you had showed a bar chart on the cumulative excess deaths from colorectal and breast cancer. Is there an association between the two, of like having breast cancer and the risk of colorectal cancer?
So I am probably not the expert on this. I know that there are syndromes, people with genetic mutations, where there is a relationship that they have a higher risk of, having these types of cancers that are related to their genetic mutation. Otherwise, like I said, 75% of women, there's no risk factors for breast cancer, and I don't think for those women, I don't think there is a higher chance if you have breast cancer for having colorectal cancer.
Thank you. Aside from breast lumps, what are other symptoms that one should look out for?
Yeah, so breast lumps, definitely please bring it to the attention of your doctors. And women always like, I don't really do breast exams, but hopefully we try to shower and bathe every day. So just from lathering the soap, just, I call it self-awareness, pay attention to your breast. So some of the symptoms that also just by looking, it's maybe not the most comfortable thing for everyone, but look in the mirror sometimes and just look for any changes, to your nipples, to the skin of the nipple areolar complex or the nipple areola area. Just making sure that we have two things are symmetric. And nipple discharge, do you notice anything blood on your bra or any discharge on the bra? Those are the main symptoms. Breast pain is common. It's not as concerning, but I don't want, any of you to be worrying alone and trying to figure out, is this a symptom to worry about? So please, if you have any symptoms of the breast, bring it to our attention. But definitely breast lumps, any skin change, nipple changes, any nipple discharge, those are the main things to look for.
And how often should one do a breast self-exam?
So I don't really think, that any of us have to do a breast self-exam regularly. I think the breast self-awareness is basically just pay attention, and then, when you clean yourself and do that, but I do not recommend to, for regular self breast exams. Yeah. But as long as you're paying attention, if you ask that question, I think that's a good sign, because you are paying attention and it is on your mind. So as long as you have awareness and breast, is involved with your breast health care, I think that is the most important thing. So I'm not discouraging people to do breast self-exams either, but I just don't want to add to your worries, because it can be challenging to figure out, how am I doing this properly? So if any question, talk to your doctor. You can ask your doctor if you have any concerns for them to do a clinical breast exam for you.
Thank you. Are there any work being done out there in the communities to encourage or offer breast cancer screening services? For example, I'm not sure if the community care vans, do they incorporate education on breast cancer screening?
Yeah, that's a really good question. I do not know, and I definitely have colleagues that are experts and leaders in this topic, and I can consult them. But I hope there is, but I do not know the answer to that.
Thank you. Okay, so while we see if there are any final questions in the chat, any final thoughts you'd like to share with the audience?
Just a central message to want to reiterate that we are here for you, and the time is now. Please come back to your breast health care. Please pay attention. Please take care of yourself. We've got to celebrate. We overcome the pandemic or survived, and it's time to return to your breast health care and to return to your screening mammogram.
Thank you so much, Dr. Chu, for your time. Everyone, thank you so much for joining us today. Hopefully you found today's session helpful. As I had mentioned, it's being recorded, so if you're interested in the video recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of the day.
Thank you so much.